patient would certainly tell you, I'll take that.
What are you using for treatment right now, if anything?
I take all the conventional treatments that are available for Alzheimer's disease, which are meant to perhaps slow down the progress of the disease and treat some of the symptoms. But that's a temporary stopgap measure for people in the early to mid-stage of Alzheimer's disease. And after that, there is nothing currently.
Yeah.
But I get a little time, so I hope I hope that our research community continues to work very, very hard. And this is a global effort, by the way, this research.
Yeah.
I can go on the internet, and I do it frequently, and I look at all of the research that's being done globally on Alzheimer's disease, and it's staggering.
Doctor, I've seen people as young as under 40 with Alzheimer's. Educate us on just how young and early onset this is happening.
So, you know, Alzheimer's, we usually divide it into very early onset and late onset. There are people in their 30s who have a form of the disorder. It's about 2% of Alzheimer's occur really early onset, and these have a more definitive genetic pattern of inheritance. And in fact, these families with this form of Alzheimer's, this very early onset form, were the first group of families that had participated in research and started focusing the research into genetics. You talk about things that have changed. When I've been working in Alzheimer's now for over 25 years, and when I first started, we started saying that there's a genetic component. There were articles written where there is no genetic component at all to Alzheimer's. I mean, now everything has, of course, been reversed, but this shows where we've come in a decade, in several decades, is that now we know that there is a genetic component. There are, underlying susceptibilities, and we have to find out how to prevent knowing those susceptibilities. So, and it's also about education. It's not just educating the populace, it's about educating physicians, healthcare workers, everybody who touches or could touch the patient, because a lot of times there's misdiagnosis. It takes a while to find a diagnosis. If you aren't going to an Alzheimer's specialty clinic where you have Alzheimer's specialists, sometimes it takes a while to get to the point where you even know what the problem is. So, I mean, I think NAPA, the laws and what we're trying to do in the Alzheimer's Association, it's about research, it's about education, it's about helping caregivers, it's about helping patients.
Thank you very much, panel, for your input. Now it's time to hear from some people in our audience.
I'm Art Kennedy. I'm a caregiver for my wife. She developed Alzheimer's about 5 years ago. I was also the caregiver for the congressman's mother along with another young lady before she passed. And the only way I'm able to survive as a caregiver is the congressman told me once I explained the situation to my wife that he didn't care if I ever went to work. You take care of your wife, we'll take care of the office. So I sympathize with those people who don't have that kind of leeway to do the things that I have to do with my wife. We have 6 children, 19 grandchildren, and they just cannot deal with it. They cannot see their mother or grandmother like that. So it falls on me and 3 other caregivers that I have. Then I ran into a problem with the government. Pay the ladies $20 an hour. And they're telling me I have to take out withholding, Medicare, and all that. I said, I tell you in IRS what? Y'all can take it and go. I'm doing what I need to do to take care of my wife. I'll deal with you all later. End of story. Thank you.
Hi, my name is Laura Jones, and I am caregiver for my husband, who was diagnosed with Alzheimer's 5 years ago at age 50 when our daughter was 3. And I'm actually really grateful for everyone to be here. I'm very grateful for this law. The biggest challenge for me is my daily life. Finding someone to take care of my husband and finding someone to take care of my daughter while I work. It's a terrible, terrible disease. I think that we need to do something to help the younger people in this country. I believe that as we become more aware of this disease, that there will be more people diagnosed who are younger and more people admitting it. I think also we need to break the age floors on some of the services. We have actually applied for some services and been denied because my husband isn't 60 years old yet. That's absurd. We all know that there are people in their 30s, 40s, 50s with Alzheimer's. So, just to paraphrase, I'm hoping that the government will take a good, solid look at the people who are younger and their families and what this impact means to the caregivers, and I'm including my 8-year-old daughter as a caregiver.
Hi, my name is Kathy Kalk. I'm here today because I have worked with the Alzheimer's Association for over 15 years. My concern is the caregivers. Last year alone, the caregivers in this country saved $202 billion from the federal government. They saved because they took care of their loved ones. There is no rest for them, and they do not have the avenues to be able to get a rest and to get a chance to rejuvenate themselves. I see this every day. Caregivers, last night I was on the telephone with a caregiver for 2 hours who cannot take care of their father and don't know what to do and is distraught and has to lose their job over this. We need our Congress people to get together for a change and to make a difference in these caregivers' lives because they need us. They are there, and they saved us $202 billion. And so it's our job to make sure they get the care that they need. Thank you.
Yes, my name is Tony Friggles, and I'm here today because of my wife. She was diagnosed with Alzheimer's at age 55, and this was 6 years ago. So for the last 6 years, we have been on an uncharted journey trying to cope with the challenges that this disease has brought to our home. We both were forced to retire and face the daily ordinary life. My biggest frustration during this last 4 or 5 years that I have been involved with the association is my perception of the lack of sense of urgency in getting things done. For instance, we are happy that this law was finally signed, but it took 4 years to get it signed, and here we are still trying to get input from the public as to what are we going to do with this law. So this may take another year before it gets implemented. We all know that there is a quick solution to this problem, and it's called money. We know that this nation has faced many other challenges in trying to eradicate other diseases, like polio. In 18 months, they got rid of polio. You mentioned HIV before, and you know there was a presidential emergency plan relief for AIDS, and in 14 months, they got from someplace $43 billion for AIDS. Now, Alzheimer's is only receiving $450 million for research and development, when it's costing Medicare and Medicaid $130 billion. So anyone in Washington just trying to find return on investment will be wise to allocate more money. You know, we're only $50 billion away from a cure. So my call to people in Washington and to people in Chicago in the Alzheimer's and to all the people throughout the United States is to raise your voices so we could finally find a cure for Alzheimer's.
Hi, my name is Lily Q. Odom. I have 2 sisters that I lost to Alzheimer's for one and dementia to the other. And I also work for the City of Miami Gardens in community outreach, where I have been around families that have members who have Alzheimer's. And I think that the biggest problem we have, along, of course, with money, is awareness. Many of our families and caretakers want to hide their family members. So I've been very impressed with Russ today because he's out and the awareness is there. But I think that what we need to do is work a little more on getting awareness for the families and the caretakers so that they are not afraid to let their family members come out and be seen and learn